Sure. I'm Jessica Randolph. I'm a medical doctor, MD, in Richmond, Virginia. I'm an assistant professor in the Department of Ophthalmology at Virginia Commonwealth University. And I have special interest in diversity, equity, inclusion issues in ophthalmology and retina specifically, and also in medical education. And I work with the ADA on their focus on diabetes eye health initiative because I'm a retina specialist. And so a lot of the patients that I see are diabetic patients who are coming to me for eye exams for problems related to their diabetes. So this Diabetes Eye Health Initiative is led by the ADA in collaboration with their visionary partners, VSP and Regeneron, and it works to raise awareness about diabetes-related eye disease and provide resources and support to people who are at risk from diabetic eye disease. The most important thing to remember is that the initial symptoms aren't any. It's asymptomatic. There is nothing that would let you know that something is going on in your eye until things are really progressed and far along. And we're starting to get into the complications end of things. That's when you start to notice changes from the diabetes. So the most important thing is to remember that there are no symptoms at all. And so it's really important to get that annual diabetic eye screening. Diabetes is the leading cause of new blindness in adults aged 18 to 64. And so that's a wide range of people that are affected by diabetes. And more often it's patients that are racially or ethnic minority patients because of diabetes is worse in these patients. And so all sorts of things, socioeconomic status, access to health care, and historic disparities in the medical system all end up with racial and ethnic minority patients having worse diabetes and therefore having worse diabetic eye disease. So it's really, really important to get that screening. So racial and ethnic minorities are disproportionately affected by diabetes. Black American adults are 60% more likely to be diagnosed with diabetes, and more than 800,000 Black Americans have diabetic retinopathy that can lead to blindness. 3 million Hispanics or Latinos are at risk of losing their sight in 2030 as a result of the complications from diabetes. And these patients are usually less likely to have had an eye exam or be evaluated for diabetes. There can be cultural or language barriers, health insurance barriers that are preventing them from getting access to this care that is so, so important for preserving vision. It's vital because patients don't know if they are having problems from diabetes without the screening. Like I said, it's asymptomatic. There are no symptoms that a patient may have to let them know that they have diabetes. And so it's important for these screenings to happen so that we can catch things early, and then talk about ways to fix it, like keeping the A1C under better control and really controlling the diabetes. And often knowing that there's potential impacts on the vision can help some patients become more motivated to really get that sugar under better control. And once diabetic retinopathy has been identified in patients, then screening them even more frequently in the clinic, and treatment if needed to prevent vision loss from the diabetes. And over 70% of vision loss from diabetes is preventable with screening. So it's really, really important that we get our patients in to see someone and have a good dilated eye exam to screen for these changes. The most important thing is that it's just essential to have your yearly eye exam. So many patients don't know and aren't screened, and then they come see me, and it's been many years since they've had an eye exam, and they can be really bad off in their eyes and not know it. And they come in thinking they're just going to get some glasses, and then they leave and we're talking about doing surgery. So it's really, really important to have those screenings. Diabetic retinopathy, when it starts out, is mild. There are no vision symptoms at all. And so it's so important to get those screenings done and get the patients in for checkups. Since these are medical problems, they are covered with medical insurance. Some patients also just don't know education-wise either about retinopathy, or they don't know that their insurance will cover the screening exams. And there's a lot of misinformation and lack of education out there for patients. So really just encouraging them to go and get those eye screenings done and have a complete dilated exam to check for this diabetic retinopathy changes. Thank you so much for having me. It's been really nice talking to you about diabetes. If you need more information, you can go to the ADA website, diabetes.org/diabetes/eye health, and find more information there.